Hello everyone, hi. Welcome to Mehul Shah Show Baton Hi Baton Mein. So today we have the man behind the project of Namaste Health, that is Dr. Anshuman Manaswi sir from Mumbai. Hello sir, welcome to my show.
Hello.
Good evening sir, how are you? All
I'm
fine? So sir, being a plastic surgeon, what made you feel to start this project of Namaste Health and what's your vision behind this?
Okay. So, Namaste Health is a dream project of mine, and it is basically based out of concept that emergency healthcare is very dismal in our country. And in the name of emergency healthcare, we have only ambulance services. Lot of damage happens before a patient reaches a hospital. To reach a hospital, you require maybe 20-30 minutes. There are various other problems which are associated in an emergency, especially serious emergencies, whether the hospital is equipped to handle your problem or whether there will be doctors over there, whether they are a specialist in that hospital. So, all these problems make the choice in an emergency very difficult. Also, there are conditions wherein only 2 to 3 minutes or 4 minutes may be there to save a life of a patient. For example, somebody who has got a cardiac arrest, heart heart arrest, or somebody who is bleeding profusely after an accident. So these are the conditions where, if at all, there is some help which can be given immediately within, let's say, within a minute, 30 seconds, and if that help can be passed on to the patient and the patient can be guided, it can save a lot of lives. And using a tech, using a video interface, that is quite possible today. So, as a plastic surgeon, what made me think so? Because as a plastic surgeon, we deal with a lot of emergency cases of injuries, and we come across patients who are bleeding profusely. Some people who have got their hands or fingers amputated, and these are the patients where there have been personal experiences where I thought that we could have done better as doctors in saving life of a patient or a hand of a patient, uh, where we failed because patients reached late. So I will give you one example that there was a patient who came to my hospital in Mumbai after 10 hours of amputation of three fingers. And he was literally carrying his three fingers in a polythene and hopping from hospital to hospital without being treatment being offered. So he went to a nursing home over there. I mean, they must have tried to bring a plastic surgeon over there. It did not happen. So they sent it to another hospital. Over there was no bed in that hospital. He went to another hospital. There again, there was some problem. Finally, he landed up morning surgeries, amputated fingers. He came to us at around 9 o'clock in the night. And obviously, by that time, a lot of delay had happened. And when we started operating, another 2-3 hours took before we took up the patient for surgery. And we were not able to save that finger. So this was one example where I said that if this is a problem in a metropolitan city, then what may be the condition in India in general, especially in the rural area. And then I started speaking to my colleagues of other departments, and we came to know that the challenges which we face as specialists or as doctors who specialize in good work is that patients don't come on time because of lack of awareness, or there may be other reasons. So there has to be a better system wherein the patient can get corrected to the right specialist and the right kind of hospital to get a good treatment which can not only save life, which can shorten the duration of the stay. Both these things are very important: good, well equipped hospital and a good specialist. So, this was our aim, how we went into Namaste Health. And also there are situational emergencies, middle of the night, somebody is there in a far off place, there are transportation problems. How does he connect to a hospital even for a minor issue? So that also becomes an emergency. Suppose there's a child having a diarrhea in the night and there are 5, 6 loose motions which have happened. Now private, I mean the doctors will not pick up the phone at that time,
Correct.
whether it is private or government. So patient needs to go to the hospital. But till the time he reaches the hospital, one single advice like giving an ORS solution may make the child much better till the time he reaches the hospital. So the concept is to provide instant help with the specialist or the specialized hospitals immediately to the patient in an emergency.
Great experience, sir. So, sir, what are the benefits of a patient using a Namaste Health service, and like how it can be compared with other traditional healthcare service?
Okay. So as things are growing, I mean, lot of health services have come in and things are improving day by day. One important area is emergency healthcare. Now, it must be surprising to you that more than 90% of the deaths manifest as some emergency or the other. Even normal diseases, chronic diseases, many of them manifest as emergencies. Plus, you think of the accidents and acute emergency cases. So the volume is quite a bit, but lot of effort has gone into management of chronic diseases, management, or I mean, you getting insurance and all these things. Lot of things have got scheduled appointments with the doctors. A lot of health apps are there in that domain. But in the domain of emergency, which is pre-hospitalization care or pre-hospital reaching the care before the patient reaches the hospital, I think we are one of the first in India and probably in the world.
Great. Can you share one critical case which you got through Namaste Health? How it was very difficult, but like how could you solve it with your team support?
So, I mean, surgeries or cases may not be very difficult.
Correct.
Okay, from technical point of view, what matters is that one should be able to reach the correct hospital, correct doctor. So as a plastic surgeon, if through Namaste Health a patient reaches me in the first go using the Namaste Health algorithm, we have an algorithm through which we know that this kind of a person should go to this kind of a specialist or this kind of a specialized hospital. For example, if somebody has got a chest pain, and then he should go to a cardiac hospital where the cardiac facility is there, angiography facility is there, cardiologists are there, interventional cardiology is there. I mean, angiography, angioplasty, all should happen. There is no point of that patient going to a hospital which does not have this kind of a facility. So that is what we have tried to map through Namaste Health using our unique algorithm. Now, from plastic surgery point of view, from the point of view of a case which has actually made a difference in a patient's life, I mean, I have treated a few using Namaste Health platform. But one case I will definitely remember is that, and that will be an experience for my life.
Okay.
And that is a patient reached the hospital. Okay. And over there, he had almost near total amputation. Limb was just dangling with some skin tag or something, and he was bleeding like a tap. And the ICU doctors and all that of that hospital, they tried their best to stop the bleeding, but it was not stopping. And at that time, they called me, and I said that by the time I reach the hospital, it will take at least 15 minutes, right? In 15 minutes, this patient will die because of the bleeding. So I took a decision to treat that patient by guiding the ICU doctors and the nurses over a video call.
Oh.
and we managed to stop the bleeding using telemedicine, emergency telemedicine, and the bleeding stopped and the patient survived.
Wow, great.
So that is the beauty of emergency telemedicine, which I can
Wow.
probably share with you. And then later on, I mean, once the bleeding stopped, then the patient's blood pressure all came down. Their
Correct.
patient blood pressure had come down to 40 by 10. So that is the kind of blood pressure down which had come down, and
Okay.
gradually it came up. Young boy
Okay.
was one was working in a glass industry, and the glass fell.
Oh,
Big
okay.
glass fell over there. So these are the times where, and I must have saved many lives by trying to stop a bleeding or to guide a patient. So I mean there are numerous examples, but this one is very close to my heart.
Okay. Great, sir. Great. So, guys, so let's take a break. And after the break, let's understand how to use Namaste Health service and keep your health better. So मिलते हैं ब्रेक के बाद. Thank you. Hello everyone, welcome back. Welcome to my show. Welcome, sir.
Well,
So, sir, Namaste Health is tied with how many hospitals and clinic across Mumbai?
okay. So as of now, we have just started a few weeks back,
Okay.
but we have in Mumbai more than 60 hospitals which have tied up. The minimum criteria for our association or the empanelment is that the hospital should be a multi-speciality hospital with a panel of multi-specialist doctors there, multi-speciality doctors with an ICU. This is the minimum criteria to be eligible to be considered as a Namaste Health emergency hospital. In that, there are many which are multi-speciality hospitals, there are many which are cardiac hospitals, and there are many which are neuro-compliant hospitals where neuro-interventional radiology can happen. Now, neurology may be, stroke may be, there are a lot of things which have recently come. जैसे हार्ट में एंजियोप्लास्टी करते हैं वैसे न्यूरो में भी एंजियोप्लास्टी करते हैं. So these things are available now. So hospital should have that infrastructure to be qualified as a neuro hospital. And we have around 500 doctors.
Pan India.
Which are, no, this we have only in Mumbai. So
Okay.
this service is available only in Mumbai right now.
Okay.
We have just started. We want to mature it in Mumbai, and if at all there are some flaws in the system, it can be worked out. And we also have a 24/7 call center. Okay, it is not that just an app. I mean, if you don't have an app, there is a 24/7 call center number. The number is 90191 00 I repeat, 90191 00 Over there, it is manned by normal healthcare executives plus a paramedic which is there in every shift. Okay, so those who don't have the app or those who have a simple mobile phone, they can also get the advice offline, not through the app, using our call center. So this bridges the gap that if you don't have the app, it is not that you become handicapped. Our aim is to provide instant medical help. For some reason, if the doctors are not available, worst come worst situation, everybody is busy, still there is a paramedic to give you life-saving advice. That is what is the USP.
Great. So, sir, like, are you covering entire Mumbai or like any particular location
No.
you're covering at a start point?
So we are covering entire Mumbai, and not only Mumbai, we are covering Thane, we are covering Vasai Virar, Mira Bhayandar, and the whole of Mumbai.
Okay.
So, I mean, it's a beginning, but we have our process rolling. Over a period of time, we will have more and more hospitals joining us and more doctors joining us.
Great, sir. So, guys, this was Anshuman sir from Mumbai, who is the plastic surgeon at Nanavati Hospital. It's an honor for us to interview him and like get the entire detail about the Namaste Health services, how and where we can save the health and get a quick recovery. So do log on to www.namastehealth.in or call on the given number which is told by Sir. This was Mehul Shah signing off for today and wait for my next episode. Thank you so much and thanks sir for your valuable time.
I just want to add one thing,
Sure.
Mehul.
Yeah.
One is that this app is available on Play Store as well as on App Store. The second thing is about it is very simple app. Once you open the app, you find that there are critical emergencies, there are normal illnesses, and there are life-saving emergencies. And when you go on either of them, you can be connected to the nearby hospitals. So it gives you the nearby hospitals which are there. That is number one. And through that, you can get connected. The second important thing is that we have ambulance services, we have home visits, we have other diagnostic services, second opinion. All these services are there immediately on a click of a button 24/7. So we are managing the entire logistics around the hospital, around the emergency.
So please everyone take care of your health and log on to namastehealth.in for any of the quick service. This was Mehul Shah signing off for today. Bye bye. Thank you so much.